Hi, I'm Dr. Shelley Safian, and I thought you might be interested in finding out a little more about exactly what is medical coding. Medical coding, in its essence, is the interpretation of details about care provided to any particular patient, every particular patient. So every time a patient and a physician or other healthcare professional get together, called an encounter or a visit, the physician is required to document all of those details, what was discussed, what the patient said, what the doctor observed, what the doctor wanted to happen next. All of that has to be documented. Now, the medical coder is going to come after that and read all that information and interpret all of those details into special codes to make it easier for the computers to analyze exactly what is going on. And we're going to discuss why you need to know that, why that has to happen, the benefits of that in a minute. But this also explains to you why anybody going into medical coding needs to really understand and take medical terminology as well as anatomy and physiology, because otherwise, how are you going to understand what the physician is talking about or writing about, actually? All right. So medical coders are going through the documentation and looking for these key components: who, where, when, why, what, and how. Now, you may remember that from the 5 W's of journalism if you ever took a writing class, but we use these components in a slightly different way. So first, let's start about the basics about the patient. Who is the patient? This will typically come off of the patient's new registration form. You know, the first time you ever went to a doctor, you had to fill out the new patient registration form. And those details, like what your name is and how you spell your name, and other particular details, we get that off of there, and it gets entered into the electronic health record, and that's where we get that information. So who is the patient? We make sure we are talking about the same person. Very important. Then we have to identify, where did this encounter happen? So the doctor and the patient may have gotten together in the doctor's office or in a hospital, acute care facility, or maybe online using telemedicine. That has to be reported as well. And of course, we must identify the date of service. Because remember, the patient record is establishing a timeline of the individual person's health and the care that they have received. And that makes the whole process much more efficient and effective. So the first thing we're going to look at, or the next thing we're going to look at, is why. Why did this person need the care and attention of a healthcare professional? Now, I know you may love your doctor. You may love him to bits, been going to him or her for 10 years now, but I'm pretty sure you wouldn't make an appointment, go sit in the waiting room, go sit in the little exam room just to say, hi, I'm feeling fine, but I just missed you. I wanted to say hi. No, there's always a reason why the individual needs the care of the physician. And so we are going to look through the documentation and see what was written about why this patient needed care on this particular date. Okay? And we're going to interpret these details using a code set called ICD-10-CM. Now that stands for International Classification of Diseases 10th Revision Clinical Modification. Whew. That's why we use the abbreviation ICD-10-CM. Diagnosis codes, which just basically explain why. Was the patient here for preventive care, like an annual physical or a flu shot? Or maybe they were here for a chest x-ray, because they have a family history of lung cancer. Oh, I hope not. But we need to know these things sooner rather than later. Or maybe the patient's not feeling well, in which case it's an illness. We need to document signs and symptoms and things. Or maybe the patient got hurt, injured, and we need to have the details on that and report that. That's why the patient was here. All of these things, the why is known in healthcare as medical necessity, and it explains why it was medically necessary for the patient to be seen by a healthcare professional. Doesn't that make sense? We got to know why. Why? So next, we have to know what did that healthcare professional do to or for this patient while they were there during this date of service? Was it an exam? Take family history, social history, vital signs, the blood pressure cuff and that evil, please step on the scale to weigh you. Okay, but it's important information, okay? Maybe it's medication administration. Maybe you're reporting for an allergist and the patient came in for an allergy shot. Maybe we're going to order some lab tests. Now, some physicians and facilities have lab pathology testing facilities right there in the building. Others, it gets sent out. We'll talk about that later, okay? And the same thing with imaging. The doctor may want to take that chest x-ray, or the doctor may want to do a CT scan because you hit your head, the patient hit their head. And that also needs to be documented. Now, just a little side note, this is where how comes in. Remember poor little how if the patient was injured, we need to know how the patient was injured and where they were when they got injured. So if it's like a car accident or fell off a skateboard or whatever it might be, you'll learn more about this later, but I'm just giving you a little heads up. Okay, heads up, concussion, nope, okay, right. Right. Now, to report the what, remember for why we use ICD-10-CM as our code set. But to report what was being done to or for the patient, we're going to use one or more of these code sets. CPT, the current procedural terminology, is used for outpatient care as well as the physician, what the physician does wherever he or she might be. Also, we use HCPCS Level 2. Isn't that funny? Healthcare Procedure Coding System. We call it HCPCS. HCPCS. Oops, sorry. Wait, go back. Okay, HCPCS. And we use those codes to report things like transportation for the patient, like ambulance service, or we might use it for supplies, like if the patient sprained their ankle and the doctor gave them a boot, or a crutch. That would be reported out of HCPCS Level 2, things like that. You'll learn about that later. And then if the patient is being cared for in an acute care facility, in a hospital, then you may be interpreting into ICD-10 PCS, Procedure Coding System. This is only used for hospital services. Don't worry about it. You're going to learn all about it. That's my favorite, by the way. Okay, so why are we doing all of this? The codes are used for reimbursement. Yes, money. Absolutely. But that's not the only reason. They also use our codes to create public policy. For example, a long time ago, analysis of the codes of pregnant women as well as codes for the babies got to explain to health insurers and the governments, state and federal governments, why it is so important that prenatal care be covered under insurance, because the benefits far outweigh the costs. And they used our codes to prove that. And now it's better for society, it's better for the population that prenatal care is covered for both the woman and the child for the rest of their lives. Evidence. Okay. Now, also medical researchers use our codes. There are cancer registrars, diabetes registrars, tumor registrars, and others where they are coders who review certain patient records to establish and enter into a database so that they can track patients diagnosed with a particular kind of cancer and how those treatments are being met, and as well as survival rates. We got really good survival rates lately. Okay. And we're contributing to that, we medical coding professionals. Okay. So I know it feels like a lot, but are you ready to get started? I think you might. So begin with chapter 1 in your textbook. And please don't forget, your instructor is there to answer your questions, to provide additional clarification, whatever you may need. But you want to get started really from day one, understanding what an important job this is. And I know you're going to have a great educational experience and a great career. Okay, let's get started.